Good morning, everyone, and welcome to this session, sharing and listening to the needs and experiences of child welfare workers. I'm Stacy Geringer, Director of Outreach at the Center for Advanced Studies in Child Welfare, also known as CASHU. Thanks for joining us. This webinar is a partnership with the Center for Practice Transformation, also known as CPT, and they are located in the School of Social Work at the University of Minnesota as well. And our funding is through the School of Social Work and the University of Minnesota and the Title IV grant facilitated by the Minnesota Department of Human Services with federal funding provided by the U.S. Department of Health and Human Services. We're really excited. This session will be led by Steve Carlson, a clinical trainer with the Center for Practice Transformation. It'll be about an hour long with lots of opportunity for discussion. This is part one of a 4-part webinar series this month. So I'll just run through a few housekeeping items and then we'll jump in, and then these items will also be in the chat. This webinar will be recorded and emailed out to all registrants. It will also be posted on CASHU's website. For those of you interested, CEUs will be emailed out in the next week or so. There will be a brief evaluation survey following the webinar that we please encourage you to complete. And then finally, please feel free to post any comments and questions in the chat. If you would like to ask a question anonymously, you can use the Q&A. There'll be several polls and opportunities for discussion, and we really encourage you to use the chat, or you are also able to raise your hand to talk live. I will let Steve take it away.
Thanks, Stacy. And I do really encourage you, you to share your thoughts, your ideas, your questions. So I just want to welcome you and thank you for joining us. I know that we're all super busy. There's so much that we have to get done, but I do want to say this is really a webinar for you. I mean, this is really about our exploration of our own wellness. And I want to get to a little bit of a sense about who is all here. So if you wouldn't mind just putting in the chat your name and the county or city or agency you work for and the role that you have. And while you do that, and I'm going to be just kind of watching that, I'm just going to introduce myself. I grew up in Minnesota. And my parents grew up in Minnesota. My mom was born in Wilmer and lived in Kirkhoven for many years. And I've lived around the state, down in Redwood Falls and up in Duluth. And so Christina, welcome from Duluth area. And Kelly, Sandy from Carlton, so up in the beautiful northern part of Minnesota. Welcome. To this. Aaron in Hennepin County. We are all truly one people. We are connected to each other in profound ways. Good to see you, Alan. I wondered I saw your name on the list that you were going to be attending. And Alan and I worked together back down in Steele County back in the 80s. So this is really about wellness, and there's so many different ways to define wellness. And we all likely have different practices that we use for wellness. For me, exercise and stretching for my body is just so important. I have come to rely on a mindfulness meditation in order to be able to practice being in the moment. And so we all have different ways of doing wellness. And the series that we're doing over the next, throughout August, is about how we can practice a sense of wellness. And it's nothing new. We all do self-care. We all do it in some way, shape, or form. And so this is a chance for us to kind of share the challenges that we face in doing child welfare work, and how do we sustain ourselves in that. And so in that vein, I am going to start with a meditation. I believe that the only moment that we truly have is right now, this moment right now. And our brains tend to live in the future and in the past much of the time. And we know from research, a Killingsworth study, that a wandering mind is a less happy mind. And so I'm going to start with a meditation that really is about remembering. It's a meditation about remembering who we essentially are and the gift that we've been given and the purpose for how we express this gift in the world. In your work, you're a family protector. It's what you do, and in some ways, it's who you are. Simply by choosing this profession, you are compassionate, which is the desire and intention to alleviate suffering in yourself, in children, and in caregivers who are struggling with addiction and mental illness. And you have a gift, and even more, you are a gift. And this gift is realized when it's given away. So as you take in this truth, uh, just let yourself settle into a comfortable position and gently close your eyes or soften your gaze as you become aware of your breath. And just breathe slowly and deeply. And with each breath, just allow yourself to become a little bit more settled and relaxed. And as is expected, you'll notice that a steady stream of thoughts continue to pass through your mind. That's okay. Simply take notice as you let go of the urgency to act upon these busy thoughts. In other words, just observe them and imagine yourself as an observer, as if you are the captain of a large ship. And you are standing on the observation deck, wind in your hair, far above the fray, watching like an eagle, aware of everything that is going on below, even the thoughts passing through your own mind. As the captain of this vessel, you direct everything, not by controlling, but simply through a deeper understanding of how things work. You are wise from experience. You've tamed the inner passions and learned to understand the passing thoughts and know just what to do as you head out to sea. And this magnificent vessel, which is your body, your mind, and your heart, has been given a purpose with unique gifts to fulfill this mission. Yes, waves of emotion will crash against this vessel, but you navigate these rough waters masterfully. Thoughts like messages from your crew arrive constantly, as if seeking, even demanding, your immediate undivided attention. And yet, with calm and ease, you know precisely what to do with these messages and waves of emotion as you press on toward the destination that is your life purpose, liberating yourself and others into love and freedom. In this moment of deep awareness and even inspiration, feel your way back to a time when you first became aware that you were called to serve others, when you knew you were a protector of children or to be involved with families in some way, when you became aware that this was your own life purpose. Perhaps it was the friends at school who seemed to want to tell you about their suffering, their frustrations, their worries, their losses. Maybe on a school bus, the long ride home, a friend shared with you that they were scared to go home. Perhaps while walking in a neighborhood park, you saw a young person who seemed to have lost their way or had nowhere to go, and she'd been kicked out, and you invited her to stay with your parents. Maybe your calling to be a protector happened because of the difficulty in your own home. Your parents fought and split up. Your mom drank to cope. Your dad worked too many hours and sometimes didn't come home at all. It's as if the stress of life forced you to retreat inside yourself as a way to protect your tender spirit and did not yet know how to spread its wings. Or perhaps your calling came simply because you grew up in a family that valued and practiced service as a way of life. Whatever the reason, whatever the circumstances, you help others because the urge to do so is in your bones. There are no coincidences. You are a protector with a unique gift to give, a purpose to fulfill. So as you breathe in this awareness, gently allow yourself to make your way back to return from this journey in time to our common space, our community of learners here. And breathe in and capture the sense of purpose that you feel, this mission that you just remembered and experienced again, as if for the first time. Returning to our community of healers, allow yourself to bring with you the mysterious and profound sense of purpose you know and understand is your calling. Taking a deep breath of gratitude for the gift you have been given, this gift to be shared with everyone you come in contact with. So, using this fresh awareness, take a moment to write down a couple of sentences describing the unique gift you bring to the world, or the practices, the values that you bring to protecting children in service to those who struggle in life. Just a couple sentences about what you bring and what your values are that lead you to bring that. As you're finishing writing that, their agenda today really will be a series of 3 polls. And in these polls, I'll be seeking some information from you and for you to be able to share with each other. And as Stacy mentioned, I hope that you feel comfortable in just raising your hand and sharing your own experience related to these 3 polls that we're going to be taking. This will help to inform what our next 3 webinars will be, that they will be specific to what your experience and your needs are. And so feel free, and I hope that you're able to share some things around this. I first just want to say um, the turnover rates for people in child welfare services are pretty high. Typically, what we look for in an agency around turnover rates is somewhere between 10 and 12%, meaning that every year, 10 to 12% or less will turn over from our organizations. And this is true of any work. We look for around 10 to 12% or less in turnover. I think this healthy rate of turnover allows us to celebrate when someone leaves an organization, that we develop these connections with our colleagues and this sense of support within our agencies. And when we move on, and there's lots of reasons why we move on from our jobs, but we look for that, a less than 10 to 12%. Within child welfare, the national average is around 30%. In some agencies, it's as high as 65%. For others, it's as low as 6%. So there's some factors going on that lead to people choosing to leave their organizations. In child welfare, it's actually a bit higher, around 46 to 54%. So there's a lot of turnover in this work. And so I want to do our first poll just to find out how long you have been doing this work. And so, Nora, if you could throw up this first poll. So it's basically, I've been doing this work for how long? And I see the results coming in. And again, there's a lot of reasons why we leave jobs. When I first started in work, back when I was working with Alan down in Steele County at the Human Relations Center, I was going through job about every 2 years. I would leave But we all, leave for different reasons and higher or lower amounts. And so, looking through this, just about everybody has responded. So, Nora, you can go ahead and publish this. So, look at that. More than 10 years, like 50% have been doing this for quite some time. We have one person who was pretty new to this, and then scattered through the 1 to 10 years. And so here's where I would like to find out from you. What is it that sustains you? For those of you that have been in this work for more than 10 years, what sustains you in this work? And you can just, for all of you, you can just either type it in the chat, but I'd love to hear from someone. You just need to raise your hand, which is, there's the little function down on the bottom. You can just raise your hand and just like, what is it that sustains you in this work? While I'm waiting for someone to respond, for me, well, actually, go ahead, Alan.
Hey, hi, Steve.
Good to hear you from you.
Thank you. Thank you. Say, I think for me, it has been the sense of purpose, that notion of kind of keeping the eye on the prize, so to speak, and that is of making that difference in the lives of the folks that I can come in contact with. In particular, I've been in supervision for most of that time in child welfare. So it takes me a little bit removed from the direct practice per se, but certainly very much in touch with it in terms of the consultations with staff and that. But it's been the sense of purpose. It's been that sense of here's the overall reason that I'm doing this job.
Yeah, yeah. And Alan, do you have what do you see as that ultimate purpose? Do you have like a mission statement, or do you have a way you define that purpose?
For me, it is I talk quite a bit in my work around the idea of compassion satisfaction, and just that idea that I am making a difference in the lives of people, of other people,
Yeah.
folks who are struggling, folks who are in pain, and so on. But that's kind of been the whole mission of my career, I think, has been that notion of being able to make a difference in the lives of others.
Yes. And somehow that is sustaining it. And how do you return to that? I mean, how do you find yourself staying connected to that purpose? Do you have practices that you do, or?
Yeah, I think it's a mindset about taking the time to recognize and appreciate the good pieces of work that I can do, or the influence I can have on my staff when they're doing the work. I've been with Olmsted County for a number of years, and we've been using this notion of appreciative inquiry as a strategy for taking the time to pay attention to the good work and making a big deal out of it. Because I think it's something we have to do intentionally, because it's so easy to overlook or not see it and get hung up on the stuff that we're getting challenged with and not able to accomplish.
Yeah, yeah. So setting an intention, and I imagine it's benefited you to be connected to the same organization for for a long time, over 10 years with Olmsted County.
Well, and I think what's been critical is that the organization itself has adapted the practice of appreciative inquiry or other ways of making note of the good practice. That it's not something I've had to do myself. It's been kind of a culture, and I think that's really important.
Yes, yes, a culture of support, a culture of collaboration, those kinds of things. Yeah.
Yeah.
Thanks, Alan. Sandy said, love for children and their well-being. Sandy, are you willing to say something about that for you? How do you connect into that sense of love for children and their well-being? Are you able to comment on that if you would like? Or Jody, the support and care of esteemed colleagues and a really helpful supervisor. Oh, thanks, Sandy. Don't have a speaker. That's fine. Kelly, Jody, the support and care of my esteemed colleagues and supervisor. And Sandy, Kelly, I love the coaching and mentoring aspect of supporting my staff as they can do the hard work that they do. Good to have us, Kelly, good to have a supervisor like you that supports your staff so much. So these are the things that sustain us in our work. All right, thanks, Jody. So the second poll that I want to take is.
I'm sorry. Oh, excuse
Yeah.
me, Steve. Sorry. Kelly had her hand raised.
Oh, okay. Kelly?
Okay, I'm over it. I thought you
Oh.
wanted, I thought you wanted people to share, and I put my comment in the chat box.
Would love to hear your voice if you'd like to share, Kelly.
Well, I just think as a supervisor, I'm not doing the direct work with clients. I'm one step removed. And I really think I work with all my staff on work-life balance and, burnout prevention management. But I think it's a really big privilege and honor to be a supervisor and to really advise and mentor someone in their career and enable them to do the work that they're doing.
Mm-hmm. Good for you, because one of the reasons, in fact, I'm going to share a slide here. There we go. So this is, let's see here. Let me just move this over. So this here is some research. There was a study done, a meta-analysis of 22 studies as to what are the things that lead people to leave child welfare work. And as you can see, over here, the low effect that didn't have much impact are these things way over here. Interestingly enough, is that caseload size, although it seems like that would be a high impact on why people would leave child welfare work, that actually was kind of low. And so some of these other things were low impact, but you can see the high effect was the amount of stress related to the work, emotional exhaustion, and commitment to the organization. And so as you were sharing about as a supervisor, both you and Alan, how you support people in their work, I think this leads to a sense of commitment to the organization and, of course, job satisfaction. But there's some other things in here around the moderate effect, which is interesting. Salary has only a moderate effect. I know we all would like to make more money, but really that's not the thing that drives why people leave their work. The supervisor support is very important. It's pretty important in here. And so all of these factors in here is what drives people to ultimately to leave the profession. All right, let me get rid of this slide here. Okay. I have another poll that I want to take, is to find out from you, what are the most difficult things that you deal with in your work? I have never actually, so you can launch the next poll, Nora. I've actually never done much child protection work, but for you, what is the most difficult part in your job? That is, what stress is most likely to lead you to consider leaving the profession? Too much to do, not enough time, challenging clients, dealing with the system, emotional labor of protecting children, the administrative tasks like paperwork, or the organization or county or team dynamics that you work with. And so as everybody's comments are coming in, I did want to say that I did have one experience in child protection. Actually, it was when I was down in Steele County, Alan, where a judge had asked me to do a reunification plan with a mother who with schizophrenia who had just given birth to a child. And so my work was to try to support this young woman in developing her skills in to be able to parent this child. And sadly, she just could not do it. And the child was eventually adopted out. But so these are the things that you have put on. You can go ahead and publish these comments, Nora, for everyone to see. So as I look through this, the highest is organizational dynamics, or the county or team dynamics is actually the highest. 44% of you said that that's a huge factor in why you would stay. The next highest is dealing with the system, which is somewhat related to the first. So our systems are really what's highest. Having too much to do and not enough time, and the stress related to that is also at 31%. Administrative tasks. And look at this, protecting children. Emotional labor is actually nobody. That's, not the challenge that you're facing. Or even challenging clients is very, very low. And so I'm curious if somebody would be willing to share a little bit about what your experience is. So many of you have been in this work for more than 10 years. What happens that leads to this kind of stress within the dynamics within the county or within the organization, or in or with dealing with the system? Anybody willing to just define what that looks like and why that becomes such a challenge? You can also write this in the chat or in the Q&A as well.
I could share one example.
Thank
This
you.
is Carolyn.
Thanks, Carolyn.
This is just an example of like what can happen. So every 6 months when a child's out of the home, we have to do an administrative review, which is just a ton of paperwork. And then on top of that, the legislature a couple years ago passed the law that some of those records are open now to the public. So now we have to redact some of the paperwork that goes to the court that we know that is eligible to be private. And so that redacting and the extra paperwork just from that one act by the legislature can take another couple of days, full days of work to get that all right and everything ready to be filed to court, where before we would be able to do it in, a few hours.
Mm-hmm.
And so in the meantime, your clients are still calling, people are still calling, needing this, needing that, and you're just stuck with this full desk of paperwork for days, and you're getting that pit in your stomach that you can't get out and help these people because the court has a deadline. It's that type of thing that is, to me, most stressful.
And that's just because of the way that the system works, Carolyn, that it's just like a glitch in the system, or what led to this becoming such a problem like this?
I think the reason the legislature changed the law that some records for child protection could be open to the public had to do with a child that died in care. And so then they wanted the process to be more transparent.
I see.
Yeah.
And that lends itself to having to change or redact so much information so that the information that the public would not be able to recognize who it was for confidentiality.
Correct. Right.
Yeah.
If the child's in care, we have to redact their placement. If they've ever been a subject of sexual abuse, we have to redact their name, their date of birth. And then, so, when you're going through out-of-home placement plans and reports and all these things you have to send, and you have to redact all this stuff, it just is hours and days of work, really.
Yeah. Yeah. Oh, dear.
That's just one example.
Yeah, that's one example. Thanks, Carolyn. Yeah. Go ahead, Alan.
Yeah, I would ditto what Carolyn's saying. I think my staff found that very specific piece to be very frustrating. But also a lot of the paperwork kinds of things. We did a lot of work around children's mental health case management. And as many of you know, there are so many guidelines and requirements and for qualifying kids and then keeping them qualified and so on and so forth. And you put so much time into the paperwork stuff to meet all the statutory requirements that it just takes away from that face-to-face actually doing of the work. And I think that's what's really frustrating for staff a lot. I know it is, yeah.
Yeah, yes. Thanks, Alan. Go ahead, Christina.
So I think I'm an ongoing child protection worker, and I've been doing this for almost 20 years.
Okay.
And I think the most stressful part for me that I've realized is just having to, you're making these decisions regarding families, you're going out and meeting with them, you're really getting to know them well. And then you have to deal with the court system with a judge who sees them for 15 minutes every 60 to 90 days. Attorneys who have their own agendas. I really feel like sometimes that hampers the work that we do or are trying to do with our clients, because we're not the sole decision makers, nor should we be. But yeah, for me, it's just dealing with all the other professionals and everybody kind of having their own agendas, because we all have our roles to play, if you will. And I feel like it really hampers, and sometimes the safety of the kids isn't foremost. And so that gets really stressful and exhausting.
Right, right. Which is the ultimate goal really in child welfare. Well, certainly to support the parents, but really, to protect children. And then that kind of becomes a less and less of a focus, or less and less time devoted to that because of all the other things you're devoting time to. Yeah. What do you do, Christina, to cope with that? What do you do to, how do you manage that for yourself?
I've come to the point in my career where I understand how the system works. I'm able to just kind of let it go and understand that, I don't have a lot of power within, like the court system. I mean, we have our recommendations and everything, but, and I just keep on working with my clients and meeting with them. And, I think just understand and letting it go is the big thing for me. It is what it is. We can do what we can do, and then it's out of our hands.
Yeah. Yeah. Go ahead, Alan. Your comment in there is this sense of being in this bind between the courts and the child. Is that what you were referring to? Go ahead. Are you there, Alan?
All right, sorry about that. Yeah, it's not like we always want to get into the court system. Sometimes it's just inevitable, or it happens, whatever. But I think as the child welfare, child protection worker, you end up in the middle of the whole process. And people get into this, by nature, it's an adversarial process when it gets into court. People take sides, and people come in with these competing agendas, all of them taking a particular perspective from their perspective. And it feels, to me, I always felt like as a child welfare worker or child protection worker, we're trying to balance all of that. We're trying to bring all these pieces into play and work with that. And yet we've got a system that's forcing or enticing people to take sides, and many different sides. And we're trying to work all that through and maintain a relationship with the client who is put on the spot the whole time. I just think that's such a tough place to be in as a child welfare worker, and we see it all the time.
Yes. Kelly, I see your hand is up.
Yeah, I wanted to talk a little bit about the agency kind of system, big picture thing. With me, I've been in child protection for 18 years as a guardian ad litem supervisor. And one of the things that I've seen is that we look at the disparities, they're terrible. There's a pilot program that's initiated, but there's no fidelity to the way the program is set up. And so it's basically a setup to fail. It doesn't work. The disparities remain as bad as they are. And now, after all this time, looking at the disparities, particularly in American Indian families, it is as bad as it's ever been. And I just find that really frustrating and really it kind of grinds you down a little bit.
Yeah. Say more about the disparities. Are you referring to like economic disparities, oppressive historical trauma, things like that?
Yeah, sure. So the number of children of color being in out-of-home placement as opposed to families who identify as white, I think poverty is certainly a factor. 50% of American Indian children in the state live in poverty. And housing is a huge issue, especially right now in the metro area. There's basically no affordable housing.
Right.
And so as a system in Hennepin County, we have continued to try and implement these policy changes or pilot programs where, we're going to address these issues, but there's no kind of accountability to that system change. And so it doesn't work. And we end up in the same place where we were before.
Yeah. Yeah. And that's the part that just as you said, it grinds you down. It becomes discouraging and a feeling of some helplessness. Or could you just say a little bit, what's the impact that it has on you? And you've been doing this 18 years.
I think it brings a sense of futility, and it's not that the work isn't important, and it's not that the clients aren't so very important, but it does. I feel like in myself and my staff, I'm combating a sense of futility, and constantly asking and answering the question, what difference are we making?
Mm-hmm. Yeah. I'm curious who would be willing to respond to this. I think this is really maybe the crux of what this webinar, this series will really be all about, as you're describing it, Kelly, is the disparities, the poverty, and the feeling of futility, of feeling powerless and, an inability to be able to, what feels like, at least our perception, to make a difference. Go ahead, Carolyn.
This is actually kind of more an answer to Christina's comments. I have been at this over 20 years also. And, an example of kind of what she was saying with this, the whole court thing is that I remember long ago, there was a social worker and he kind of grew to hate Christmas because we would be finally getting a child real stabilized out of the home, maybe in foster care, came from a bad situation, only supervised visits for the parents. And the judge, like Christina said, has seen this kid for 15 minutes every several months and just said, oh, it's Christmas. He needs to go home, or, and we're like, oh my God, and then we know that the trauma is going to be worse when the kid comes back, and your hands are tied with that. And so, like she said, you have to let it go. But I think also the whole thing, and what the last person said, for me at least, is that it's that the only thing you can do is just keep your relationship strong with that child. And, that kind of that old saying that, children, the more healthy adult relationships children have, the better the outcomes. And so I think sometimes when that's all I have left, the decisions are out of my hands and I know it's not good. It's just supporting them when they come back, nurturing them when they come back. And like, that's all I can do sometimes at that point.
Yeah. Well, yes, hands are tied. That's a powerful metaphor for what we're talking about here. And yet you have found a way to navigate that by keeping that relationship strong with the child, and with the recognition that perhaps that presence, that relationship, that care, that love, that that sense of support is what ultimately will be a memory in that child's history, that they remember back that they are loved and cared for.
Right. That coupled with like just vehemently fighting for them in court, doing
Yeah.
your best to do what you can do so you can walk
Yeah.
away going, I did everything I could. And then, keeping that relationship strong. Yeah.
Yeah. Go ahead, Alan.
That reminds me of so many times over my career having heard staff come in and say, oh, guess what? The other day I ran into this person who I worked with 5-6 years ago. And at the time, it was maybe even a difficult, contentious relationship at times. But in retrospect, this kid would say, you were such an important person in my life at that time and place. And I know I treated you like crap and whatever, but I learned a lot from you, blah, 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 blah. And those kinds of stories, I think, are the kinds of things that also help sustain us in this career. We don't always hear it right away, but then somewhere down the road, you run into this client in the grocery store and they say, oh my gosh, you were such an important person in my life.
That really helps with the grinding down. That really helps to it's really helpful to get that information. And it's rare that we probably do that we actually run into a client at the grocery store years later, or that's very gratifying. Carolyn, did you have another comment?
No, I didn't.
Okay. All right. Oh, so this is so helpful to hear, because what you're describing are things that is being able to determine, what do I have control over and what do I not have control over? I mean, it's the old wisdom of the Serenity Prayer. There are so many things that we do not have control over, and those that we do. And if we can ride that fine line, sort of that razor wire of knowing what I have control over and what I don't. For example, we have control over hopefully keeping that relationship strong with the child. That's something that we maybe have control over. What the court does, we don't. And I think I learned that by working for 20 years with people that lived homeless on the streets and supporting them and getting into housing in Minneapolis, is that I learned what I had control over and what I didn't. And that really did sustain me quite a bit to continue doing the work and finding the strengths that were inherent and integral to that person that was living on the streets or in a shelter with mental illness, usually. I have one more poll, because this will help to maybe to guide us to this understanding of our own mission. I think, Alan, you really let it off well with this sense of our own purpose. And the social work has identified 6 core values. There's so many core values. You don't have to choose one of these, but which of the core values would you say is the thing that you can stay connected to, of like why you do this work? What your core value is that supports you in getting up every day and putting on your shoes and doing this work? What or in the chat, put another core value that perhaps you have. There's service, social justice, dignity and worth of the person, the importance of human relationships, integrity, and competence. This is what National Association of Social Workers has on their website as the core values of social work. But there's a lot of other core values. So many of you have responded to this, and just about everybody has responded. So Nora, you can go ahead and post this. And so the highest was this dignity and worth of the person. Is somebody willing to share how does that resonate with you? It is hard to pick one. Who put dignity and worth of the person, and how does that inform how you do your work? how do you connect into that, and how does that help inform what you do? And anyone from that sense of value of the person, or the importance of human relationships, which was second highest. Anybody want to comment on how this helps to inform what you do? The reason I'm asking this question is because I think that one of the things that can sustain us, I think, and this is really mentioned by keeping the relationship strong with a child, there is a value in healthy children. There's a value in seeing children become contributing citizens, of discovering their own value, their own gift that they have to offer their world, and what their own core values are. And so for me, my mission in my work is informed by values around service, spirituality, and really a presence and meaning in life, and a sense of purpose in life, and probably social justice, which, as a an older white male with a lot of white male privilege, this is what I can do, is be present in that way. But my mission is to liberate myself and others into love and freedom. And so when I connect with my mission with some kind of intentionality, I think, Alan, you mentioned this as well, as being intentional around my work. And so in the morning, when I need to do my meditation, my stretching, is I will reconnect with whatever that inner part of me, where that core value exists, and connect with my intention for the day. What am I really all about today? And there's two other elements. Go ahead, Alan. Go ahead and comment on this.
Well, I just think that that notion of dignity and worth of the person actually underlies pretty much the other values. I mean, that's part of what leads to the importance of human relationships. It's certainly the core of social justice and service. So, I mean, that's kind of how I had a hard time picking one, because it just felt like they were kind of interconnected, but that was the one that seemed to be, kind of the bottom line in a way.
Yeah. And sometimes it's just being able to name what it is, to be able to identify it, so that I can set an intention around that. Because it's not so much a word, it's more of a felt sense of energy, a felt sense of connection to others, and a desire or something to connect. And so I want to leave you with just three things before I wrap up here and talk about what we're going to be talking about next Wednesday, is these three things around intention, attention, and attitude. I learned this from the Center for Spirituality at the University of Minnesota when I took a course from them, is this setting an intention, finding what that core value is. And if that core value has to do with keeping the relationship strong to a child, or being a presence to that child, or to being present to a parent who is struggling with an addiction, with wanting to provide a sense of social justice for their situation by advocating in the courts for them, or in a housing program. So it's setting that intention. And then the second part of that is that attention, which is where, when I am with that person, when I am with the person in court, or when I am advocating for a person, or whatever I am doing in my work, is that I am attending to that person, and that I am attending to how I am expressing my core value with that person. And then thirdly is attitude. This is the one that always comes up for me. Is my attitude. I can easily be judgmental. It's just part of my nature. I think both my parents had a tendency to be judgmental. And when my judgments rise up, I notice them, I observe them, and I let them go. And they can be, all forms of justice, or judgments about somebody's not doing something well enough, or someone's not trying hard enough, or the system is letting us down, or whatever those judgments are. Recognizing those attitudes and learning how to manage those attitudes. As Viktor Frankl said, it is the one last freedom we have, is the ability to choose our own attitude. And that is where we do have some control, is over that. And so with that, I just want to describe what we're going to be talking about on August 11th. There's this mindfulness phrase, you cannot pour from an empty cup. Given that there is so much we don't have control over with respect to courts, systems, housing availability, the cost of housing, there's so many things we don't have control over. The one thing that we can do is have practices that fill our own cup so that we can give to others. And so next time we're going to be talking and sharing a little bit about resilience and how do we cultivate that resilience? How do we connect with the core value that we have and sustain ourselves in that core value, which is where we find our reserve of wellness, or that inner sense of strength inside of ourselves. So that's what we're covering next time. And I think, Stacy, did you want to wrap up and let people know about the podcasts or what those types of things?
Yep. Thank you, Steve, so much. And thank you everyone for joining and your participation today. We really appreciate it. Just a few reminders. This webinar will be recorded and emailed out to all registrants, and it will be posted on our website. For those of you interested, you will also receive one CEU. And then there'll be a brief evaluation survey right when we close this Zoom, and it's 4 or 5 questions. So please just take a moment to give us some feedback. And then, yeah, as Steve mentioned, please join us next week to discuss filling our cup. And like he said, we'll focus on identifying signs of burnout and creating a resiliency plan. We're going to put information and registration in the chat for that part 2, along with part 3 and 4. And then also check out the Center for Practice Transformation, and is creating some podcasts. And we released one on Monday for Mindfulness Monday, led by Steve. And so this one is called Hope in the Midst of Despair. So we'll also put that in the chat. Please feel free to take a listen, and we really hope you enjoy it. Thanks again. And thank you, Steve, for a wonderful webinar.
Thanks, everybody. Hope to see you next Wednesday. Thanks, Stacy.
Thanks.